Nothing to call on Keith Buchanan.
Please.
His question. The Northern Health and Social Care Trust have actually had 4 new providers contract with them in the past while. Collectively, they've taken on 766 packages of care totalling 6,659 hours. The Northern Trust continue to target recruitment of home care staff across the Trust's geographical area, with additional focus on areas where there remains a larger level of unmet domiciliary care need. Demand for domiciliary care packages continues to outweigh capacity within the sector to take on this work. I do recognise the important role of our independent sector home care providers and have approved funding in advance of the 24-25 budget being confirmed to address the requirements of the employer in relation to the national living wages increase. And I have recently announced a £70 million support package for social care providers and hospices. I hope this funding will help the independent sector organisations deal with rising costs.
Mr Buchanan.
Thank you, Minister. Thank you for your response so far. Minister, my own mother is a service user, and I see all the work that's carried out day and daily by those workers. The new providers you talked about, the 4 additional providers, when do you see this having a real impact in the Northern Trust? Obviously, the Northern Trust is one of the most largest with a backlog in Northern Ireland. When do you see that in a timely manner? I only recently had a lady in her 100th year had to wait 6 months on a care package.
Minister.
And I think the member, it was my intention that that £17 million roll out as quickly as possible. I've made the announcement actually in advance of a budget being agreed, because I do know that we have that high level of unmet need, especially across the Northern Trust at a local level, because, as the members indicated, not just of the size of the area that the Northern Trust covers, but also the rurality as well. So I do hope that the additional monies that is put in, the Trust is currently reviewing how they commission domiciliary care services to ensure actually a value for money approach and to proactively drive efficiencies to optimise what capacity they currently have.
Ms. Sheeran.
Minister, appreciate the update that you've given us already. I know that obviously I've done a lot of work with the Trust, and even at the end of January, when one of these new providers was first announced in our own situation in South Area, it was sort of robbing Peter to pay Paul, because another provider had just left the area. Can I ask you specifically, I've just come off a Teams meeting with a lady whose father has been in hospital now for 11 months. He's got complex needs. He's ready for discharge, but he can't get a package of care because he's got complex needs. And the Trust are basically saying that the only option available to them is a placement in Rathmina in Ballyclare, and they live in Blahy. So could you outline what support, particularly for those with more than just the 4 visits a day, you're working on, Liddell?
And I thank the member for the point. If she wants to write to me with that specific case, I'll get back to her and engage with the Northern Trust in regards to that. But she does highlight the issue in regards to those additional complex needs. We had made provision where people who were waiting a long time, especially on a care package, were able to go into domiciliary care. Sometimes that does meet a need, sometimes it doesn't, but in the individual case that the member's talking about, if she writes to me in regards to that.
Eula McAllister.
For your response so far. Recognise that care packages also exist for those who are not adults and children specifically with learning difficulties and extreme challenging behaviour for their parents. And I asked the Minister what exactly his department is doing for the families who have now waited almost 4 years for respite services in the Northern Trust area.
Minister.
The member will be aware, and I think at the Health Committee she did raise Rainbow Lodge in regards to a specific facility within the Northern Trust, and she has raised that. I have one back to see what additional capacity there is across that facility, but also across the entirety of Northern Ireland in regards to respite, because this is an issue, Mr Speaker, that doesn't affect just the Northern Trust, but our supply of respite is again constrained by the pressures that we're seeing in those cases, like the previous member indicated, where those complex additional needs is actually consuming quite a lot of our current respite care.
Mike Nesbitt.
Thank you, Mr Speaker. The announcement the Minister referred to in terms of additional funding was warmly welcomed within the sector, but in terms of sustained investment and clarity, can the Minister advise what his department is going to do to increase capacity within the home care workforce?
Minister.
Well, I thank the member for that point, because In regards to the announcement that I did make in regards to that additional 17 million, there have been 2 uplifts to the independent sector home care rate within the last few years, and that has been done, Mr Speaker, to recognise the complex work that this valuable workforce does, and actually to entice more staff into the field. My officials have established the Social Care Collaborative Forum as an outcome of the review of adult social care. That forum is looking at many issues around home care, including maximising capacity and actually the home care workforce, and they are working with the Northern Ireland Social Care Council on developing actually standardised enhanced training, the recognised qualifications and promotional options for home care staff within that field of work. And my hope is that those measures that I have referenced will actually grow the workforce and drive down some of the unmet need that we have across the province.
Hunter.
Speaker, I thank the Minister for his answers so far. Minister, many who go without care packages have to stay in hospital even when they're fit to go home. Does your department keep statistics of how many or how long patients are kept in hospital when they're fit to go home but cannot access a care package within the Northern Trust?
Minister.
We do, and it is something that I've actually asked departmental officials to look at, and they have been looking at it. I have a team within the department that has been established, actually within the Strategic Planning and Performance Group, and they look and manage and engage with trusts on delayed hospital discharges through a range of regionally agreed measures. But I need to be realistic. Stabilising and enhancing social care represents a part of that answer of delayed discharges, but that requires sustained and significant additional funding. So there's other constraining factors at work as well as that it's not just waiting on social care packages that are the result of those delayed discharges, and there is ongoing work within my department to look at those and actually challenge trusts as to whether they could be doing better.
Jerry Carroll. Minister.
Puberty blockers are only available on NHS prescription for those under 18 who were accepted and remain in the Belfast Health and Social Care's Trust Knowing Our Identity Service endocrine pathway prior to March 2020. In March 2020, following the consultation with the Clinical Ethics Committee, the Belfast Social Care Trust, in liaison with the Lane Health and Social Care Board, amended the service specification whereby new referrals after that date would no longer have access to the endocrine pathway. This was due to challenges within the Adult Gender Identity Service, given there was no readily available appropriate transition pathway for young people at age 18 to allow for the safe continuation of endocrine treatment. My officials have been working with the Gender Identity Service Pathway Review Group and the Gender Identity Service Liaison Panel, which includes clinical, managerial and service user representation, actually to develop the Gender Identity Service. At the Liaisons Panel's next quarterly meeting, due to be held in June 24, they will have the opportunity at that point to discuss in detail the ban on puberty blockers by NHS England.
Mr. Carroll.
Minister, there's been an orchestrated campaign against trans and the non-binary community across these islands, and I'd urge you not to follow that, especially given recent comments on the Health Committee. Minister, what commitment will you give to young trans people that they will be able to get access to puberty blockers, gender reaffirming services without any intervention of you, your department or your officials going forward?
Minister.
I thank the member for the clarity. As I said in the opening answer, puberty blockers are only available in NHS prescription for those under 18 who have already been accepted and remain in the Belfast Health and Social Care Trust Knowing Our Identity Service prior to March 2020, and that was following consultation with the Clinical Ethics Committee, the Belfast Health and Social Care Trust, in liaison with the then Health and Social Care Board.
And Dodds.
Thank you, Mr. Speaker, and thank you to the Minister. Minister, last week the publication of the CAS report caused a significant degree of concern. What action is your department going to take in light of the publication of the CAS review? And can you explain how puberty blockers introduced in the UK merely for research trials could come to be prescribed in a routine clinical use despite not being licensed for this, or there being any meaningful evidence about their safety? And how many children might these have been prescribed to in Northern Ireland?
Minister.
I thank the member for her questions. Our principal focus on this issue in regards to the CAS review has to be providing the best health care and best support for our young people. And I would echo the comments by Dr. Hilary Cass about the toxic and polarised nature of much of the debate on this subject, and that's particularly the case, as the member will know, on social media. This toxicity is not in the best interest of our young people, nor does it help us find the right way forward in terms of healthcare and support. Of the specific questions she's asked around numbers, I don't have them with me, but I will write to the member with an answer and share them, Speaker, with the Assembly.
Owen Tennyson.
Thank you, Mr. Speaker. I'm sure the Minister will agree with me that our priority in this area has to be ensuring that trans individuals get the appropriate care and that their dignity and human rights are respected at all times. Will the Minister commit to engaging further with the LGBT sector and children's rights organisations before pursuing any further change in this area?
Minister.
And again, I thank the member for his point. As I said in my opening answer, my officials have been working with the Gender Identity Service Pathway Review Group and the Gender Identity Services Liaison Panel, and that includes clinical, managerial and service user representation to develop the Gender Identity Service. The Liaison Panel is actually due to meet again in June 24, where this subject will be discussed.
Jim Allister.
The Liaison Panel advises and you decide. Given that the CAS report highlighted the irreversible harm of the use of puberty blockers, can you give an assurance to this House that there will be no return to their destructive use?
And again, I thank the member for referring to my substantive answer at the start, and that's that puberty blockers are only available in NHS prescription for those under 18 who were accepted and remain in the Belfast Health and Social Care Trust Knowing Our Identity Service endocrine pathway prior to March 2020, and that is the current stance that I've been advised on in regards to that piece of work that was done following consultation with the Clinical Ethics Committee, the Belfast Health and Social Care Trust, in liaison with the Lane Health and Social Care Board.
Call Danny Donnelly.
Speaker, question 3, please.
The reduction of waiting lists is a key priority for me and has been indicated as a key priority for the Executive, and my officials are currently taking forward a range of measures to address this. However, as the member is aware, this is a complex issue and it will take time, effort and, importantly, adequate recurrent investment. In that respect, I acknowledge fully the need to have in place measures to help those on waiting lists. The elective care framework, when I published it in 2021, proposed a £700 million investment over 5 years. Whilst it set out firm and time-bound proposals, unfortunately, as members will know, the subsequent absence of any agreed executive budgets, combined with the political disruption for much of the period since, the implementation of the framework has not been what it should have. Nevertheless, there's still been some good progress made across several areas. The member is aware that I attended the meeting where the Welsh Initiative was presented, by the meeting that was sponsored actually by his party colleague. The initiative and the potential benefits this has for patients on waiting lists. I've asked my officials following that presentation for an assessment of the implications of a similar process here, including the potential costs, and I will then consider that in the context of advice from officials.
Mr Donnelly.
Thank you, Mr. Speaker, and I thank the Minister for his answer there. The Minister will also be aware of the Worried and Waiting report, which was launched in this building earlier today, showing that paediatric waiting lists in Northern Ireland have increased by 173% in the last 7 years, which is wholly unacceptable. With far too many children and their families waiting for outpatient appointments, I would like to ask the Minister what he is doing to communicate with and to support people who are on these waiting lists and often feel very isolated and forgotten.
And I thank the member, and again, although I wasn't able to attend the launch of the report today, I did meet with the Royal College of Paediatrics a fortnight ago in regards to the report, and spoke through some of the recommendations they had, and had quite a good engagement with them at that event. There's a wide range of online wellbeing support available in regards to people who are on waiting lists that exists across primary care, where the multidisciplinary team programme is improving access to early supports and proactively supporting good physical and mental health and social wellbeing. A new online tracking system, which the member may be aware of, My Waiting List, was launched on the 25th of May last year, which allows patients to check the average waiting times for first outpatient hospital appointments across different clinical specialities in each Health and Social Care Trust area. And the new My Waiting Times Northern Ireland website provides detailed information on average assessment and waiting times by speciality and in trust. In addition, the website provides links to support patients' health and well-being whilst waiting for treatment. It provides information on travelling to appointments, the hospital travel cost scheme, patient transport service, and advice if treatment is no longer required or if a patient cannot attend to their first appointment.
Liz Kimmins.
The Minister for his answer. And in relation to the worried and waiting report that has been published today, can I ask the Minister if he has had time to consider the report and whether he intends to initiate a child health system review to identify the needs aimed at reducing child health inequalities as has been called for within the report?
Minister.
As I was able to talk with the Royal College of Paediatrics on I think it was the 4th of this month, in regards to update them as to where the Child's Health Partnership and the Project Board actually is, about how we look at bringing children's services within the department onto an even keel and actually tackle some of those horrendous waiting lists that have been described. In regards, I suppose, Mr Speaker, to the other recommendations there, I think the Royal College are fair in regards to how we tackle health inequalities, especially among our young people, but that isn't solely a challenge to my department, the Department of Health. I think it's a challenge to every department and our executive as a whole, actually how we improve access to education, those early years structures and supports, access to special educational needs, housing, welfare, all the rest of it. So when we look at the approach that's being proposed in the programme, where it looks about the child-centred whole child approach, I think it has to be a whole executive approach.
Chambers.
Thank you, Mr Speaker. Today's report from the Royal College of Paediatrics has reiterated the awful figures that many of us have known for some time. Over a fortnight into the financial year and with little budgetary clarity still on the horizon, can the Minister provide an update the challenges his department and the trusts find themselves in when trying to tackle the problem of our waiting lists with effectively one hand tied behind their back?
Minister.
And the member makes a valid point which has been reiterated across this House many times, not just by me but actually by executive colleagues when they talk about waiting lists. It's the challenge of that non-recurrent budget, Mr Speaker, that doesn't allow us to make those strategic changes that we want to do across health, because it needs that long-term recurrent investment. So when we look at the waiting list initiatives, funding that my department has been given over the past number of years on a single year budget, it makes those larger pieces of transformation that we want to do all the more challenging, but we still push on in regards to looking at how we develop overnight care, day case procedure units, rapid diagnostic centres, while we can do that within the remit of the budget that I have available, but also the workforce that is available as well.
Matthew Hill.
Mr Speaker, Minister, the state of the health service in general, specifically the length of waiting lists, is probably the single biggest example and crystallisation of chaos in public services, and the thing that most of the public in Northern Ireland want dealt with most quickly. It has to be at the core of a programme for government, but we heard from the First Minister and indeed from the Deputy First Minister today that there doesn't seem to be any great hurry in the production of a programme for government.
Please,
Do you believe it's an urgent priority, and will you be pushing for health to be right at the core of an urgently produced programme for government?
Minister.
I think the member, I push all the time that health should be central to everything that we do, not just in regards to a programme for government, but also a budget as well. That was the commitments that were made in this House when this executive was re-established. I want to hold my executive colleagues to that commitment and that promise, not just to me as Health Minister nor my department, but to the people of Northern Ireland, because the member's right, it is the most, I think, crucial topic that we talk about, something that is affecting every household across Northern Ireland. In regards for a programme for government, I think, Mr Speaker, a programme for government will be beneficial, but it has to be a funded programme for government, a costed programme for government, which I'm sure we don't disagree on. But when we're still working with a single year budget that doesn't allow the large scale transformation pieces, I'll still push for funding for my department, for the health service and for waiting list initiatives.
Colin Killian.
Question number 4, please.
Minister.
I thank the member. Children and young people with disabilities receive dental care across a range of settings in Northern Ireland: general dental services, community dental services and the hospital dental services. Those with the most complex needs are treated in the Belfast Health and Social Care Trust Royal Victoria Hospital under the care of paediatric and special care dental consultants. The Children's Hospital in the Royal Hospital site provides care for children up to 13 years and young people 13 to 18 years at the School of Dentistry. The Strategic Planning and Performance Group have sought clarification from SPPG PHA governance team and from the Belfast Trust, and neither are aware of any reported severe adverse reactions relating to dental procedures in children at the Children's Hospital or young persons at the School of Dentistry or within the wider Belfast Health and Social Care Trust services, including the Community Dental Service General Anaesthetic lists from 2020 to the present day. Whilst I cannot discuss individual cases, there may be ongoing serious adverse incidents related to dental care, which are currently being raised through the Belfast Trust's established processes, and in line with established serious adverse incident processes, the Trust will ensure the appropriate level of engagement with patients and their families throughout any investigation.
Ms. Hoolan.
Minister, I've been in your position before where officials in good faith give you an answer and you respond to it. I'm telling you that's not fact. My constituent, Ollie Duffy, died in January of this year as a result of complications in the RVH. So, and that was an adverse incident as far as I'm aware. If it not, it should have been. Which again, could I ask a minister to go back and ask again how many children and young people have had adverse reactions who have got disabilities and complex histories? Because I know for a fact there's Alex is one, but there are others.
Minister.
The member, as I'm sure she's aware, I'm not aware of the specific case that she has raised. If there are ongoing SAIs in relation to a specific case, I don't have the detail here in regards to the individual that the member has raised. I will go back and ask officials in the Belfast Trust to investigate it, and the member, I'm sure, would expect nothing less from me.
Patsy Midlone.
Question 5.
In addition to existing areas of cross-border cooperation, my officials are engaging and considering proposals from Minister Donnelly's office for further collaboration across several priority areas. This includes enhanced cancer service provision, alcohol, drugs and substance use and children's services. Cross-border cooperation on healthcare will also be facilitated through the Peace Plus programme. This provides funding and significant opportunities for tackling shared challenges in health and social care across both jurisdictions through partnership working. I'm always willing to explore cross-border collaboration where there's a clear population health need and a sustainable long-term solution, and I will continue to engage with Minister Donnelly on areas for further partnership working, primarily through the North-South Ministerial Council.
Mr. Malone.
Thank the Minister very much indeed for his answer. Indeed, he answered my supplementary. But furthermore, would the Minister please consider, I did recently refer him a case, a very rare form of genetic cancer. If there was an opportunity to deal with that on a cross-border basis, or maybe further collaboration indeed with some UK hospitals.
Minister.
And again, the member raises a specific issue, but on the wider engagement piece in regards to cancer specifically, Mr. Speaker, the member will be aware of the All-Ireland Cancer Consortium, an outworking of the Belfast Agreement in 1998 has been set up, still does good work. I signed a renewed memorandum of understanding back in 2020. Myself and Minister Donnelly have spoke about it. We engaged in the North-South Ministerial Council. But we also spoke prior to that, just shortly for me returning to office, when we did have engagement.
Linda Dillon.
Can Corlia and thank the Minister for his answers so far. Minister, you will be aware that there is a motion come to the Assembly today around the baby loss certificate and pathology services. Previously, whenever the Assembly wasn't in place, the Permanent Secretary did say that they would look at an all-island pathology service. Can you update us on whether that is being looked at and what conversations you've had with your counterpart in the 26 counties around an all-island paediatric pathology service?
Minister.
And again, I thank the member for the point, and I'm aware it is part of a debate later on. It is conversations that we have been having across both departments as to how we make best use of facilities both in Northern Ireland and Southern Ireland, because we both currently face the same challenges. Paediatric pathologists are a very small workforce and work pool, and we've been unable, no matter how many recruitment processes we put out over the past number of years, actually to be recruiting anybody. So we are looking at all alternatives in regards to an all-island approach, but also still maintaining that relationship with colleagues in the United Kingdom, where we are currently utilising facilities in Alderhay, while we still try to get a provision here that looks after the support that's needed for parents and families who find themselves in that very challenging situation.
Mr. Dixon.
Your answers so far, Minister. Can I welcome the work that is done on a cross-border basis at the North West Cancer Centre, but encourage you to expand that? But would you agree with me that none of it can really hit the road running until the Northern Ireland Cancer Strategy has been implemented? When is that going to happen?
Minister.
The member will be aware that the Northern Ireland Cancer Strategy was something that I launched and something that I made clear would only be delivered to its full when it was fully supported financially, and that would require commitment from parties around this service. It's not something that I nor my department want to skimp on or see not delivered fully. Unfortunately, where we find ourselves, it hasn't been able to progress, as I said in an earlier answer, at the pace or the veracity that I would like to have seen, and that has been due to the lack of that recurrent budget, as due to the lack of there not being a minister actually in position to drive that. But there is, as the member has indicated, not just the ongoing work in the North West, but the All-Ireland Cancer Consortium is involved in that cross-border work as well, and there are discussions within the North-South Strategic Group around the developments of priorities for joint research projects and clinical trials, which will be supported by funding from the Health Research Board in the Republic of Ireland. So there's work goes on that cross-border issue. I would wish that I had the funding available to fully implement the cancer strategy, which I launched when I was last in this office.
Speaker.
Member for his question. Lagan Valley Hospital is our flagship regional day procedure centre. It was opened in October 2020 in the midst of the pandemic. The day procedure centre at Lagan Valley Hospital provided much needed regional support for urgent and red flag day procedures in response to the downturn in elective activity in other hospitals. And since opening, the Day Procedure Centre has treated over 13,500 regional patients across a number of elective specialities. That includes plastic surgery, ear, nose and throat, general surgery, breast surgery, urology, ophthalmology, gynaecology and varicose veins. And that includes a mixture of general anaesthetic procedures, local anaesthetic procedures and diagnostic procedures, utilising both the theatres there and procedure rooms. And in addition, the Day Procedure Centre at Lagan Valley Hospital also delivers endoscopy sessions for the region. And as of the 17th of March this year, the Day Procedure Centre had delivered 4,465 scopes. The Day Procedure Centre at Lagan Valley forms part of a wider network of elective care centres that aim to enhance the efficiency and quality of care for our patients and help to drive down our lengthy waiting lists. Plans for further expansion of elective care centres will be subject to sustainable funding and their workforce required to build further capacity.
Mr. Butler.
Thank you, Mr. Speaker. I thank the Minister for his answer, and I echo the Minister's kind words with regard to the performance of the Lagan Valley. Just want to offer the invitation for the Minister then to join me and visit the Lagan Valley site and to update himself in person with the fantastic facilities and provision that they're making there.
Certainly accept the member's invitation if he puts it in writing to me.
Colin McGrath.
Speaker, would the Minister consider utilising the Down Hospital to deliver elective care procedures and other procedures, given that there is capacity within the hospital to deliver those and a very willing workforce?
Minister.
And I think the member will be aware I visited the Down a while ago when I was last in office, and I do agree with him. It is a fantastic facility, and as I've made clear, Mr. Speaker, in this chamber many times, that I need to utilise every square foot of all my hospital facility, and I do hope when I later publish our regional blueprint for our acute hospital sector that it receives good support and endorsement throughout all the parties in this chamber.
1 minute, Ms Dodds.
Will the Minister let the chamber know when he proposes to bring forward his plan for the reconfiguration of hospitals in Northern Ireland?
Minister. I thank the member for that. I hope to do it within the next couple of weeks in regards to where we currently are.
Thank you. Colin McGrath.
Mr. Speaker, Mr Speaker, last week at the Health Committee, Dr Alan Stout from the British Medical Association said that on the current trajectory, primary care, our GP services in our community, has 12 to 18 months before collapse. Do you share his assessment?
It's not assessment that has been brought to me in writing, but I am aware of the current pressures that our GP and primary care are currently under in regards. That's why we're currently working through that review of the GP contract and what we need to go forward. We have a good working relationship with Dr Stout and his colleagues in regards to making sure that we work in partnership to ensure that we provide a future for GP services going forward.
Thank you, Mr Speaker. Given that your officials last week could only highlight MDTs as a possible saviour for primary care, could the Minister confirm that he has specifically requested additional funds from the Minister of Finance for the continued rollout of multidisciplinary teams right across the North?
Minister.
I haven't put in a bid for specific MDTs at this point in Garage. I've made a wider bid for a health service and Department of Health budget. The member is right to identify MDTs as regard to actually receiving that special funding. He will be aware that under New Decade, New Approach, they were an approach that was actually funded under transformation. Those teams that are established are now considered core service now, so they're no longer under that funding stream. So any further investment in MDTs will be transformation monies that we look for, but also how we expand that. I actually attended a conference last week, Mr Speaker, in regards to how the South Eastern Trust was working with primary care and actually promoting and enhancing MDTs across the province. And actually one of the Trust facilitators, or one of the people who presented there, actually made it clear that initially they were sceptical about the benefit, but now they come to rely on MDTs as a key part of the health service. So not only are MDTs crucial going forward, so is the review of our GP GMS contract as well, and the member will know that's something we are working to finalise shortly.
Brian Kingston.
Speaker, the Minister will be aware of the crisis in funding for our community pharmacies. Two issues recently raised with me are, first, that the drug tariff paid here follows the English rate and in many cases below the actual cost of medicine, and secondly, that a clawback in government funding is already 9.7% and is due to double to around double that figure. Is the Minister aware of these issues, and is he seeking a review to ensure the viability and continuation of our community pharmacies?
Minister.
I thank the member for the point. Community pharmacies, as the member knows, continue to play a pivotal role in delivering health services to communities in Northern Ireland. They have and continue to be some of our most accessible healthcare professionals on front line of community health during the response. There's a very high level of public confidence in their professionalism and dedication shown by community pharmacies during what has been extremely challenging years. My department recognises the fundamental role that community pharmacies have been carrying out and has repeatedly acknowledged the concerns raised by Community Pharmacy NI, who are the representative body for community pharmacy, and by individual contractors themselves in respect to drug pricing increases and the differences due to inflationary and cost of living increases generally. My department remains committed to working with CPNI on commissioning arrangements within the existing ministerial mandate and financial envelope. However, it's important to emphasise that there's no provision for additional funding for the community pharmacy sector within the current assessed budget available to health, and that's disappointing in regards to our overall package. The department is working, and there are significant difficulties facing us financially, but I do want to work as close in partnership with community pharmacy as is possible.
Mr. Kingston.
Well, I thank the Minister for his answer, but it is disappointing that there is no prospect of additional funding coming to community pharmacy. The pharmacists who I've met with tell me they themselves are not able to draw a salary. They are literally using up their own life savings out of loyalty to their customers and to their staff. And I ask again, is the Minister seeking to take forward any sort of review on the funding arrangements, or is he just accepting that there's no money available?
Minister.
I will say to the member, currently, as he knows, I have no budget currently available. But in relation to 24-25, I have approved actually front-loading DDRB uplifts in recognition of the National Minimum Wage uplifts in April 24, and that will be paid forward in £1 million per quarter to be reviewed in year in light of budget and the DDRB. I've also approved non-recurrent funding of £4 million associated with medicines adherence service pressures and an increase of the retained margin from £26.5 million to £31.5 million on condition that CPA and I agree a concurrent margin survey methodology, and this becomes a target rather than the minimum threshold. So it's not that there's not monies there. I have already made those commitments to CPA and I, and we continue to engage as to how we can actually progress and support them.
Stephen Dunn.
Can I ask the Minister for an update on investment proposals to further support NHS dentists? And are there any lessons we can learn from dental reform across the UK?
Minister.
I think the member for his point, and he will know that I have actually just recently announced some additional fundings into dentistry in regards to what we can do moving forward in regards to access for children, and also an increase of the PIPA scheme in regards to how we can consult them or support them as well to make sure there's more access for community dentistry for people of all ages.
Mr. Speaker, thank the Minister for his answer. What advice would you give to the many parents within my constituency of North Down that are simply unable to register their child with an NHS dental practice, especially considering the importance of dental health within early years?
Minister.
And I thank the member, and I can supply more details with him in writing if he wishes, but the announcement in regards to the additional package that I announced in dentistry, there was actually £1 million specifically earmarked for that, for dentists, NHS dentists to take forward and work with unregistered children in regards to that, but I can't get that detail to the member in writing.
Question 4 is withdrawn. Call on Tennyson.
Thank you, Mr. Speaker. The Minister will be aware of the stark warning of the British Dental Association that a proposed prohibition on dental amalgam could leave NHS patients in Northern Ireland without care. Can I ask the Minister, is he seeking a derogation on that new law?
Thank the member. I'm aware of the developments regarding EU regulations on mercury, which actually includes dental amalgam, and they are a cause of significant concern. The changes would significantly restrict dentists from placing amalgam fillings, increase costs for patients and taxpayers, and have a negative impact on the capacity of a service that is still struggling since the pandemic. My view remains that a phase down, in line with the wider UK position, rather than a phase out of amalgam, is the best interest of patients in Northern Ireland. I am, however, conscious that this is a matter for the New Windsor Framework Democratic Scrutiny Committee to consider in detail in terms of their role in assessing impacts in Northern Ireland, and thereafter members of the Assembly will wish to consider whether the initiation of the Stormont Back process is necessary and justified. My department has already written to the committee to advise of concerns around the significant and persisting impacts of the new laws, and I will continue to help the committee in any way I can.
Mr. Tennyson.
I thank the Minister for his answer, but surely the Stormont Break mechanism is a last resort, and we should be seeking to engage as best we can to secure a derogation in advance. So I ask the Minister again, does he believe a derogation is the right option, and what engagement has he had with the UK Government and European counterparts to pursue that aim?
Minister.
I thank the member for his point, and I'll continue to engage with ministerial colleagues, as the member I'm sure is aware that this regulation also falls under his party colleague, the DAERA Minister's remit, because it's an environmental issue. But I will continue to work with him as a ministerial colleague. I'll also engage with colleagues across the UK, because the EU mercury regulation applies directly in Northern Ireland under the terms of the Windsor Framework, and that regulation has been incorporated into UK domestic law as part of the retained EU law. So the current position in the UK is that that measure has been incorporated to phase down the use of amalgam. So I'll continue to work with ministerial colleagues, UK colleagues, and indeed the BDA to redress this.
Question 6 is withdrawn. I call Mr. Robbie Butler.
Thank you, Mr. Speaker. Would the Minister be in a position to give us an update in regards to the shortage of medication in relation to ADHD?
I thank the member for his question in regards to that. While supply disruptions of some attention deficit hyperactivity disorder treatments have now been resolved, my department is aware of ongoing supply distribution involving various strengths and preparations of other ADHD treatments across the UK, which has been caused by a combination of manufacturing issues and an increase in global demand for these products. As the Department of Health and Social Care leads in the maintenance of medicine supply chains to the UK, my department has been working closely with them, the other devolved governments and the Medicines and Healthcare Products Regulatory Agency to ensure the impact of these shortages are mitigated and patients can continue to get medical supplies they need. There are national and locally tried and tested mitigations in place to deal with medicine shortages, and during this period of supply disruption of ADHD treatments, communications have been issued to healthcare professionals across health and social care settings, which have provided advice on appropriate actions to take to manage patients affected by these disruptions.
Mr. Butler.
Thank you, Mr. Speaker. I thank the Minister for his answer and assurance in that regard. The Minister would also be aware that Brexit had implications in regard to the medical alignment in terms of packaging and licensing. Could the Minister give us an update, or is he confident that the post-Brexit arrangements are indeed still working, and if there was any impact on those medications due to that point?
Minister.
I thank the member. In regards to these specific medicines, I don't think there was any direct implications in regards to that. The medicine supply notification was issued in regards to specific products on the 13th of February, and that means there will be periods when certain strengths may not be available, but that doesn't come directly from any impact as towards Brexit negotiations or any outworkings from that.
Patrick Bryan.
Can I ask the Minister what he is doing to resolve the delays in red flag breast cancer referrals in the South Eastern Trust area, which have been caused by the rollout of the Encompass system?
Minister.
In regards to the rollout of the Encompass system, I am aware of some delays to certain procedures, but I am assured again by the South Eastern Health and Social Care Trust that those are being worked through. In regards to a wider process and in regards to how we actually access red flag breast assessments, there is now a regional approach being taken across Northern Ireland while we try to equalise the service provision that we currently have to make sure there's that equality for service. But this is something that we do need in an area that we do need significant investment in, and especially in regards to red flag procedures, which have been on an increase over the past 3 years.
Minister, or Mr. Bryan.
Not yet, Mr. Speaker. What specific learnings and actions is the Minister taking to avoid this happening when the system is rolled out in other trust areas?
Minister. And I think the member first point, and I think now he refers specifically to Encompass. The advantage of rolling it out initially in the South Eastern Health and Social Care Trust has allowed us to identify which has been some challenging areas of communications and framework, delivery through different letters and different procedures of how we notify different parts of the system. Those have been taken away and learned from, and I'm hopeful that there has been workarounds and changes to methodology put in place, that those areas which are specifically identified for Northern Ireland Trust, which haven't been in other programmes, will be addressed as we further roll out Encompass across Northern Ireland. Belfast Trust coming now in June of this year, with the Northern Trust following in November.
David Brooks.
Thank you, Mr. Speaker, and thank the Minister for his answer so far. Could I ask what discussions he's had with the Education Minister to ensure a joined up and collaborative approach to addressing the needs of SEND children and their families?
Minister.
I haven't had any direct meetings with the Education Minister, but it is something that he and I have spoken about on the edge of an executive meeting recently, because it is an area that I think we do need to work in partnership with. It is something that the Education Minister has actually expressed his admiration for the healthcare workers who are working in the school setting, especially in the support of special educational needs. And I think that is a piece of work that our two departments can work on collaboratively for the best approach for those children.
Mr. Brooks.
Thank you. Could I encourage him to have those conversations and to encourage his officials to do so as well, particularly around data sharing, I think, at the earliest possible stage to support the planning for education, but also for the increased integration of DOH counterparts to the local integrated teams as well at the earliest possible stage? Thank you.
Minister.
No, and I thank the member. I didn't maybe make myself clear. Although he and I haven't engaged, our teams are deeply engaged and deeply embedded as we work how do both departments actually support young people with special educational needs. We are acknowledged in regards to the significant numbers who are now needing assessment and additional supports, and I do think it's something that we can work cross-government, cross-departmentally to make sure we get that joined-up approach in regards to what are a number of children who do need those additional supports that we can provide as we work together.
That concludes the time for questions to the Minister for Health. I would remind members that if a member is asking a question, that another member doesn't walk in front of them. That's the member is asking the question.